Brisbane is in shock. The city, which appeared to have largely dodged COVID-19, is back in the same place it was 12 months ago, in full lockdown.
I think it's just an illustration of how quickly the virus can escape into the community and wreak havoc.
This is the source of all the trouble. A major hospital that hasn't been able to keep the coronavirus from escaping into the community. Now questions are being raised about the state's vaccine program.
It's been frustrating for many reasons to watch the way that it's been rolled out so far.
And why some frontline health workers still haven't been immunised.
I think it's very easy where we stand now to be somewhat critical, but in fact I think we've got to look at the extent of the task.
ABC News. Southeast Queenslanders are tonight holding their breath after a Brisbane doctor tested positive to COVID-19 after being in the community.
The first seed of these clusters of the highly contagious UK strain of coronavirus was planted 19 days ago, when a doctor who had treated a COVID patient at the Princess Alexandra Hospital recorded a positive COVID test. The health professional had not been vaccinated.
We are only in week 3 of the national vaccination rollout.
The full ramifications of this didn't become apparent until last week, when a cluster of new cases was traced back to this doctor. And then on Sunday, a second cluster was discovered, with now 11 confirmed cases originating from an unvaccinated nurse working in the same hospital, triggering a blame game over the vaccination rollout.
We're going to help the states, but they've got to admit they've got a problem because they've done 3/5 of bugger all. And they are holding this nation back, and unfortunately our premiers haven't led on this.
State ministers from both Queensland and New South Wales today fired back.
The Prime Minister committed that 3 million Australians would be vaccinated by the end of March. Well, today is the 31st of March, and he has fallen 2.4 million short of that target.
For 15 months, every government in the country, every state and territory government, has maintained a very collegiate approach. But as Health Minister here in New South Wales, I'm extremely angry. And I know there are other health ministers in the country who share similar views, state and territory health ministers.
Late today, the Federal Health Minister was taking a far more conciliatory line.
I'm in the school of working with the states and territories. That's what we've done for over a year now, and that's what we'll continue to do. And I think all of them are doing their absolute best, and they're doing an excellent job.
Cairns GP Dr Aileen Taves is not sure where responsibility for the delay lies, but she worries about her frontline colleagues who are still waiting for the jab.
A lot of very valuable people have been vaccinated on our front lines, and that's fantastic, but it has been a bit of a haphazard approach to how that's occurred.
Queensland health figures show nearly 90% of frontline health and quarantine workers have now been vaccinated. And some of those working on the front line are reluctant to criticise what they argue is a complex rollout.
I think if you look at, first of all, the delays in supply that were outside of anyone's control, and so I think that points to one of the difficulties.
The task of vaccinating tens of thousands of frontline healthcare workers in a very short period of time is always going to be a logistical challenge.
One issue that doctors do raise is the quality of some of the protective equipment, arguing for a faster rollout of the highest grade fit testing PPE.
My understanding is that fit testing is occurring to a greater degree in other states such as New South Wales and Victoria.
So there is a process in place, but the risk here is just that we've had such a rapid ramp up in cases. So all of that's been worked through with all of those staff.
The COVID crisis has spread across the border to Byron Bay, where the infected nurse attended a hens party. It's meant tighter restrictions for the region, and the town's annual blues festival has been cancelled for a second consecutive year. Byron resident Dan Struzina went for a COVID test. It came back negative today.
Byron in the area here We've been really lucky in the sense that we haven't had any community spread, I believe, until potentially now. So, because I guess every new community case is potentially 10 or 15 more in a few days to come.
Back in Queensland, authorities have been encouraged by the community response, with a record 33,000 people turning out for COVID testing yesterday.
I think there is an enthusiasm to embrace all the responsible things. So long as people are mindful of that and don't drop our guard, we will all be able to work towards better results in these challenging times.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.